there. How's it going?
It's been over a year now since the pandemic gripped the nation. The vaccine is here, and so many feel the worst is over. Some of the horrible outcomes are easy to quantify, like numbers of cases, recoveries, and unfortunately the lives lost. But there's another toll, one that isn't always visible.
It was a trauma, and just the thought of facing a small part of that again put me in to a really bad place.
For frontline workers like Maureen, they carry a lot of what they've seen with them. How do doctors, nurses, those fighting the fight and witnessing the absolute worst, unpack one of the most horrific years in history? Is that even possible?
You can prime the blood to be a lot closer to the patient's IV site. Okay.
The truth of the matter is that clinicians weren't just overwhelmed with the number of patients, they felt helpless at first.
There's no peer-reviewed articles, there's no evidence-based practice. It's just, you just keep trying things, and you keep what works and you throw out what doesn't, and that's not a way of practicing medicine that I think any of us were prepared for or used to. You know, you go to school, you learn what works, you learn proven treatment regimens, and typically when science is advanced, it's done so over time, and it's not there's not a cost of, you know, hundreds of thousands and worldwide millions, you know, of people. To know that, like, you're just trying what you think is going to work best, you're doing the best you can, and you have no idea if that is going to be the right thing, the wrong thing, and if it'll work, and if it will save this person and they'll get back home to their family or they won't. That's heavy. That's a lot. I still see that moment where the first day that I ever worked in the like the outside car line, and the first patient we came across, who was a little bit of an elderly lady sitting in the car with her husband, and we got a set of vitals, put a pulse ox on her finger, and her pulse ox was like in the 70s. And like, you know, okay, we got to go, we got to get this patient inside, we got to get her looked at, treated, and they had that moment, this like moment in the front seat of their car because the husband couldn't come in, and to like be standing at somebody's door and like watch this moment where they're like have to say goodbye to each other, and nobody knew, right, if she was going to come back out again. That was like, that has stuck with me, and that is probably one of the hardest things I've ever witnessed. I cannot imagine that kind of uncertainty. And you want to be able to promise that away, right? To promise that, you know, she's going to be fine. She's going to, you know, get better, and you'll be able to see her soon. And to not have the ability to make that promise that was very hard.
How do you unpack? How do you take it all off? How do you have it not affect, you know, like the Maureen, the mom in the morning, or the wife at home? How does that happen? Or does that happen?
I don't know that happens. I think you do the best you can. You hug your family, you hug your kids, you make sure they know how much you love them. I think there's a lot of things that I felt like I couldn't share. And there are a lot of things that even if I tried to share, there's just no way, you know, even, you know, interviews like this, or to try to use words to explain what it was like, it feels really impossible sometimes. So there's a lot that you don't share, and there's a lot that just stays rolling around up in your head. And I don't know, that's hard.
I mean, how do you deal with that stuff like floating around inside your head? Do you address it?
I don't know. I mean, I think that in an ideal world, you do, right? I know that, you know, just very personally speaking, I made a career changed kind of. I mean, I'm still a nurse very much, but I definitely changed how I'm a nurse. I also have, gone to see my physician and pursued, some medical options to get through some of that. And I think I think right now in the medical world, in the nursing world, we're realizing, and it's something that we've known ever since last year, we've been talking a lot about resilience, wellness, how you take care of each other, and all of those things. But I think there's kind of a renewed push right now because we feel it, right? What are you doing about it? I don't know. I think to talk about it, people ask, have you gone to talk about it? Have you talked to a therapist? Have you, everybody's different. I think that could be helpful for some people. I think sometimes I feel talked out, like I don't even know what to say about it. And I think it'll probably be a long time of processing before I feel like I have a complete peace with it.